the organization for about 3 years, but I've been working alongside them for 10 years. So I'm really well informed of everything they've been doing and the changes. A couple things, we have been expanding a lot with counseling services. So we've had to expand to a new building, and we're growing with growing pains, going into the medical field as well. So things have been changing, our dynamic has been changing a little bit, and I'll go over a little bit of those programs. But if you guys have known of Inland Housing Solutions, they started in Loma Linda, in an old house that was rented for a shelter. It started as a 30-day shelter over 30 years ago. In addition to that, it went into transitional housing. Every time that the organization has identified an opportunity for growth, they've expanded, right? So it started at 30, went to 90, then it was a transitional housing program, and then here's a little timeline of the last kind of 10 years. COC changed all transitional housing programs into a rapid rehousing program, which has been our biggest growth, right? So all our programs now, we don't run a temporary shelter or transitional housing. It's all in rapid rehousing and services, right? We did do rebranding, so if you look us up, you'll see us as Inland Temporary Homes. Because we went from being a shelter to transitional and being temporary, we rebranded into Inland Housing Solutions, Finding Housing Solutions. So anytime you look us up, both names will come up, FYI, and a lot of people draw our attention. And then in 2022 is when we got most of our contracts with IHP, and I'll go over the details on that. We were running a program with DOS, but that one slowly closed last year. And we got ECM, which is Enhanced Care Management through IHP, so I'll go a little bit through those programs. It is our newest program. We're still waiting, and we'll have a quick conversation after on our HAP funding. We still haven't received HAP. We got awarded for 3 regions, and it's still pending for all 3 regions in negotiation with Office of Homeless Services. I was not able to get an update for today after 3 months of conversation. But most of our programs and our experience is over 30 years. Again, we focus on rapid rehousing, finding housing solutions. I want to emphasize that we're not the immediate, we're not a shelter solution, and that's why a lot of the times you guys won't see us in the community, because we're under the radar, right? We're getting these referrals through different channels, and then through that process, we're getting them service with enrollment, looking for local resources, and then connecting them straight from housing, regardless if they're in a shelter, if they're homeless, or wherever they're located. So usually, again, we go unseen for a lot of the time, but one of our longest standing program is our COC program, Continuum of Care, which is a rapid rehousing. That one's focused for family with children. We do navigation, move-in cost. It is all programs, rapid rehousing, just as a background. It's not permanent supportive housing, so it's considered short-term. It is a case by case. Most of our programs and our members last about 9 months of rental assistance. It's an average up to 12 months. Of course, we have those outliers that sometimes, and especially with COVID, we've had to help I want to say over 18 months on some cases. But it's really evaluated on a case by case. The individuals get a case manager that's assigned to them, that's working with them on a monthly basis or bi-weekly, depending on the amount of work that's needed, helping them budget, giving them life skills and things like that, and connecting them to resources, right? The biggest hurdle is navigation, finding a unit, because we're not affordable housing. It's finding a unit in the area that they're choosing that's livable and that they can attain to, that they can afford the rent when our program ends. It's our biggest challenge, right? We're doing navigation for the county of San Bernardino for the COC for about 6 years for the whole county, right? So we were identifying units across all San Bernardino County and providing it to local providers that had COC funding. So we truly know how rents have increased in the last 2 to 3 years and how they're not attainable to a lot of members that we're serving. So that's been our biggest challenge, especially in the last year. A lot of the rents, even the members that we were servicing, rents increased like up to, I think they allow up to 10%, right? And it really impacted some of the members we were serving. So we had to provide more rental assistance to get them stabilized. So it took away from being able to house more people. With our COC contract, it is very specific. Again, it's very important to understand the channels of referrals. We can't take direct referrals because we're part of the coordinated entry system. So they have to go through the CES system for this program. This one is family with children or individuals that are pregnant that qualify for this. We serve about 16 to 20 families a year with this program, and it is a case by case. If 211 doesn't have a hub out here that's doing outreach, but any outreach should be connected to CES, and hopefully the outreaches are, because that's where the work starts, right? If they're getting connected to coordinated entry system and someone tells us, hey, we have this family over here, do you guys have funding? We try to pull referrals. A lot of the times we're asking, I think I went to case conferencing a month ago and they didn't have 3 families for me. I was like, I need 3 families, I need to spend money. Our contract ends October, right? September. So we need to spend money. So we're always asking CES for referrals, but sometimes where the community partners can come in if they have a family that has already been engaged in outreach and they're already verified through the coordinated entry process, they can let us know. Send me an email and we can reach out to CES like, hey, is this family ready for referral? Are they in the housing queue? Like, hopefully you guys understand all the new CES processes, but if they're in the housing queue, it allows us to pull a referral, right? And again, this is anyone, any family with children that is homeless. There's no income limits coming in. 0 income are welcome, even though they'll be harder to serve, but we continue to strive and provide them services. The goal is while they're in the program to increase their income and stabilize. As long as they're able to increase their income, then we're working with them to do that. So again, this is our longest standing program. Once we receive a referral from coordinated entry, we are reaching out to the members within 72 hours. So if you guys, I want to emphasize, have families, please plug them into the coordinated entry system. I know we have a difficult time getting referrals from CES. I'm gonna skip the videos because of time, but we have a couple and I'll share the presentation so you guys can see it. But our next biggest program, this is where I wanna emphasize if people that have IHP are being connected to community supports. So we're one of the largest community supports providers in both San Bernardino and Riverside County. I wanna say we receive about 150 to 200 referrals a month, right? In both counties. Part of, if you guys are familiar with CalAIM, they have 14 community supports programs. 4 of them are emphasized for housing stability. All others are for different type of disability. I put a list right here, and I also included a link where you guys can get more information with IHP about this. And this is very important for stabilization. For us, we meet with some of these providers to help and stabilize some of the members that we're having with complex disabilities, right? And some of them, they don't require homelessness, it could be low income as long as they have IHP. And I'll go quickly over, and there's one that is coming up that we're excited about, which is in January 2026, which is a new one down here, which is transitional rent. So based on a lot of feedback, are you guys familiar with CalAIM services? It's a one-time assistance, right? We know in our community that doesn't really stabilize anybody, right? So luckily with a lot of data and a lot of information, they were able to find out that one-time assistance, people were gonna fall back into homelessness months later. Because of that, and thankfully for that aspect, transitional rents got approved through up to 6 months. Will be approved, and in our community for IHP, it'll start being active as of January. So we're waiting to get more information to make sure that we can provide. So instead of just having that one-time assistance, it's gonna transition to at least up to 6 months of stabilization, which we're really excited because we definitely don't like housing people and then falling back into homelessness, right? We get 4 as of right now. We get the home modification, housing deposits, and housing tenancy support, and housing navigation services. So for our home modifications, that is through IHP. You guys have any members that, as long as where they're living allows it or approves it, it doesn't have to be owned. It could be that they're renting and they need modifications. As long as they're calling IHP, letting them know, they can send the referral to us or any of the other providers that do this, and we have up to $7,500 for those modifications, right? Which isn't a lot in the modification and home modification. So if you're expecting a whole shower replaced with the contractors and the amount of cost right now, the shower wouldn't be approved because the cost, and it has to be fully covered by them. There's a lot of restrictions, but the pool bar and adjusting it or retrofitting the shower would be, because it would be a smaller cost. But a roll-in shower where it has open or tub, then that's something that wouldn't be approved because it's like over $30,000, right? Again, system, anything that's required for wheelchair accessibility, any type of disabilities, all IHP members are eligible for this. So just wanted to emphasize this, if they do have this service. That was our newest program. It was a learning curve. Again, this will be a video that kind of shows and reflects a situation like that. But our next two are housing, which is a tongue twister. We call it HTNS and HTSS. Again, these are not financial assistance, but for us to be able to provide a deposit assistance for the household, this is how the referrals come, and this is what IHP recognizes and how they're called. So first, they would send us a navigation kind of referral to help them find a unit in areas that they're eligible for. Then once we find a unit, then we can request a deposit assistance as a referral. And then if they're needing case management, we can continue case management up to 12 months, but it doesn't include any financial assistance. And again, that's where I was saying that a lot of households were falling back into homelessness, and luckily the numbers reflected that, and now they're extending it. Housing deposits would cover anything from security deposits, first month's rent, last month's rent, if that's what they're asking for that, but with all the new laws, they're not required to do that. But anything that they're requesting, that limit's $5,000 right now per household. So in some areas, it lasts a little longer, right? Depending on how the housing and how much we can provide, but it's up to $5,000. And other areas, it takes it in first month's rent and deposit. So it just depends where they are in the county. And again, that's a one-time assistance right now, until hopefully January 2026.
Is it one time a year or one time forever and ever?
Right now, it's one time, according to IHP, but we have had cases that we advocated for that they allow like an extension, but keep in mind it's a one time up to 5,000. So if they only use 4,000, they can still get assistance through us or any provider up to the other $1,000, right? So right now it's one time in a lifetime program, but there has been some cases that have been approved, but it's not who we do the approval, it has to go through IHP.
Is that for families, so like married partners, or
no, that's for everyone.
Individual?
It's for households in general. So
households in general.
Yes, so this one is not a family program, this is anyone, individuals, single adults, seniors. 30% of our referrals are seniors.
So potentially like a family unit that's not married could have 10,000.
If there's two referrals, yes. It could be, we haven't used it in that aspect, but if they're both IHP members and they both have a referral, then there could be a combination. We haven't exercised it in that way. Usually we get a referral, it could be the child that we have the referral from that has IHP and the parents don't. As long as there's a parent in the household that could get a lease, we can get approved for that, right? So it could be individuals by themselves, any type of familial.
One last question, sorry. So if it's born for lifetime and the parents use the child for IHP, that child, when they become an adult, can't use it?
As of right now that I know of, no, but again, it's changing as of January 2026, and there's still not a lot of clear guidelines of what that implicates after that, because right now it's like set at this 5,000. It has for the last 3 years that we've been running it.
So I have a question. So I actually, back in January when I was ill, I was in the hospital, probably 7 hospital admissions at 3 different facilities and so forth. And I already was, I've been without a job or a paycheck for like 2 years because I wasn't taking a salary. So I'm actually being evicted. I probably would have been evicted 2 months ago if I didn't have a great relationship with my property manager. But anyway, so I made an arrangement. I just, I'm going out of the country, so I'm kind of just, for a while. But my question is, I have IHP, but I'm through Borrego Health, which merged with, as you know, a DAP down the hill. But that's my provider, even though I live up here. So anyways, but since I'm contracted with them, does that, would their case manager have to talk to you guys? Or, I mean, how would someone get referred into your system, I guess?
I'll go over that right
now.
now.
Okay, cool. This is interesting because Astrid was going to help me file for the same thing, but again, I don't like to take social services that are, there are far people worse off than me.
It's a benefit, and I will say there's always benefits in earned ways. So this is what I just talked. This is how the referrals happen. We get a navigation referral for the members through IHP. Then once we identify units, we request a referral for the deposit, so it takes about 2 to 3 days, we're pretty quick. Once they're housed, if they need case management, we'll reach out. But the biggest thing is this right here. So we don't qualify the individuals, IHP does. Back of your IHP member services, you would call. You have to be specific that you're asking for community supports program, because their call center is not the best, right? And they have so many programs. I've been on the call sometimes with individuals to help them advocate for an hour, trying to get to the right team, right? But you have to state that you're homeless or in a housing crisis. So for them, you don't have to be literally homeless. You can be at risk of homelessness.
Okay.
Those are some of the keywords to make sure that you're getting to the community supports team, right? They'll do an intake, and especially if you're a high utilizer, as you mentioned, right, that it's considered a high utilizer.
Yeah.
They would have referred you not only to a community supports provider, for rental assistance and that, and again, it's up to 5,000, and sometimes it is arrears, right, in some cases. But then also to an ECM, which I'll go into ECM for our program, which is Enhanced Care Management.
Because Borrego, which that was, anyways, they keep saying the case managers are supposed to reach out, and they did once, and then I keep trying to get them, and
But each medical center.
so I don't have to go through them at all. I can just call IHP, and
No, this is directly through IHP.
That's great.
IHP does their own intake, regardless if you're contracted locally, but it's going directly to IHP. Kaiser has a similar program, and Molina as well too, but we don't run those two programs. But they also, if you look up community supports for IHP, for Molina, or for Kaiser, their page will come up when it comes up, right?
Cool.
And it tells you the details. But literally, and there's also a member service email, but this is the number you would call. Again, it's really, really important that you say you're at a housing crisis, and that you want to get referred to community supports, and then they'll do their intake. You may ask for us as a provider. Again, we can't take direct referrals. They get assigned to us, or any community, or they'll look for a community support provider that's probably more local to you guys as well too. So if there's an establishment out here, then they will put it out here most likely, right? Just to have more access to it. And this kind of comes to you. The turnaround times once you go, again, this is not an emergency service. This is based on what IHP, by the time someone does an intake, it takes them 5 to 7 days to tell you if you qualify or if you're getting referred, right? So they have to give you a clear either letter or information that you're declined, or that yes, you qualify, and who they're sending you to. But they tell you, give them a couple days. We have up to 3 to 5 days to reach out to the individual and establish a connection, and engage them, to continue our process, to do our intake, and then ask, we have a housing intake where it says, okay, where do you want to live, what can you afford, and all this stuff, right? And then this, again, right now, it's a one-time assistance. We always recommend people to start looking for units that they can afford in their area to speed up their process, but it's not a requirement. We help them look as well, but sometimes there's specific areas that they want that is a little, or they know more people in that area that it's easier for them to attain. And it could be a room for rent. It has to be very specific. It has to have a lease agreement, right? Everything has to have a lease agreement, or a unit, a studio, anything like that, as long as it's, and then it has to go through a housing inspection, so it has to be approved by our housing inspector, right? We want to make sure we're placing people in places meant for habitation.
These programs, these programs are only for IEHP members.
The ones I'm talking about today, yes.
And do you have any sense for, or any data on IEHP participation here in the Morocco Basin?
Not the full. I have some data on how many referrals and how many people we've served in the last year for us, which is at the end of the presentation. So I have some numbers, but usually through IHP, I know
And is IEHP the provider for Medi-Cal, the underlying program, or is it a separate program?
So Medi-Cal, you get Medi-Cal, and depending, you attach yourself, you select as a member IHP, Molina, or Kaiser, right? I'm not sure how it gets distributed to each members, but most people select their own, or they get assigned to one. But it is anyone that's receiving Medi-Cal, right? And depending on the tier of services, so DBH falls into Medi-Cal as well. Depending on their mental health, it goes either to IHP or DBH too. So it's just very different. So anyone that has Medi-Cal could select one of these service plans, the managed care.
Do you provide any services for either of the other two providers?
it that way yet. We're still trying to we're getting so many referrals for IHP. But, there is a Cali meeting that happens, Thursday once a month that has all the providers out there. So Kaiser presents, all us, all the Cali participate, and then Kaiser and Molina present at that one. But I can send a link again for community
The vast
supports.
majority is IHP
But
here.
90% of Medi-Cal members, from what I know, are IHP members. About 90% of Medi-Cal.
Alright, thank you.
Can I ask you a question? Could you get us statistics on how many of those IEHP members that you've assisted come from the Morongo Basin?
I have some numbers of the last year or so, yeah.
That are specific to the Morongo Basin or specific to the county?
No, to Morongo Basin.
Okay.
So we upgraded our system and it's still under construction, but we wanna make sure that we can provide for each city and we collect by city. Yeah, so I pulled a few numbers.
Can I ask a question? So most of the individuals that have IEHP, I'm currently trying to get a contract with them now.
Yeah.
But because we lack the services here, when someone calls you from this area, where are you guys mostly referring them to? Is it Riverside County or somewhere, like, are you referring them to resources here? Or do they have to go out of the county because we don't have a lot of resources here?
So it's on case by case, so we reach out to the county to see if there's shelter that's needed. We reach out to local resources to see if there's availability of mental health vouchers. We look at 211. Our case managers go through the whole gamut, so we try to keep them in their area and find them a resource. I know the county is about to close contracts in motel for the last 3 months that we've been waiting on, or 4 months now, to see, but we try to reach out to local resources if they say that, they're needing a bridge right now. For the most part, we move forward with them regardless of where they're at. We come see them here in the area, get anything we need to, get them document ready so we can get them into housing. So for the most part, unless they're wanting to go into a shelter, most of them know their resources locally. So they'll say, no, I know where to go, or they'll reach out themselves, but we continue to work with them for housing.
Okay, thank you.
But we don't refer them out to other counties. We try to keep them in their area for the most part.
Okay.
Yeah, is this related to the HOPE program for Riverside County? The HHOPE, home housing, I can't remember all it stands for. It sounds like a similar process. Do you know?
I'm not too familiar with that program, but it is Caleen, and again, these are community supports are through IHP.
Right, and
Yeah.
so that's part 2 of my question would be, for specifically the HOPE program, is a housing program from specific to Riverside County, and then they branch off. It needs to be a referral through a county certified social worker in order for IHP to recognize it. Is that still true for this program?
No,
Okay.
no. These are directly through IHP.
So I can.
So they
I
have
can
to call directly through IHP, and then the referral gets sent to one of us, which we would consider community-based organizations.
Okay, perfect.
Yeah. So they don't have to go through the county in any way for this specific funding. And that I know of, this funding is not moving in that route. They have HIP funding that might go that route, which is a different funding source. But just through here, it's a direct referral from IHP.
Somebody told me that they needed a physician referral.
I'm sorry, they needed a.
Somebody told me that they required a physician referral, that they have to be referred by their physician.
They could be. One of the things is it has to be a health need, right? And if they are assigned to a physician, the physicians and that are contracted by IHP should be referring, but that's not the case. That's why they have called the 800 number. Eventually, through it's supposed to go that way, but it didn't work out. So they do their own intake. And they'll let them know, like, hey, we need to go to a physical, then they'll try to help them schedule that if it's part of the requirement, but it won't stop their process for approval.
They also IHP also does Medicare. Does this cover Medicare clients?
From what I know, as long as they're part of the IHP health plan, it covers them with the county. Yeah, because they have many medis, so we've gotten a combination. As long as the health plan sends us a referral, we don't have to verify homelessness. That's the great thing about this. We don't have to verify their housing. They do their intake, they do the pre-approval, and then we could just move forward with them.
So let's just go, I wanna touch on one quick thing that you said. You said it has to be a health need. So essentially, if my husband and I, let's say we're IHP members, we lose our jobs, you know, through no luck of our own, but we're healthy individuals, we have no comorbidities, our kids are up to date on their vaccines, we all just had a physical, we're good to go. Does that mean that we no longer qualify because there's no health needs?
Well, that's a good question. I would have to confirm with them. Some of the aspects for this one, it doesn't require complex health needs, but say you have anxiety or you have any type of, anything that can be connected, even though your physical is healthy, there can be different things that can be connected, right? Right now, if you are homeless and you don't have a food resource, right? That puts you guys in a different situation. There's a lot of different situations. They haven't said specifically for health needs. They always look for health needs to connect it, to make it justifiable for claim and reducing health costs. But we've had referrals for everyone, and it hasn't, you know, for anything and anyone, as long as there's a need. I know sometimes they do ask, like, can you increase your income, and it may limit who they refer you to, because this is not for someone that's zero income, this is not for someone that's chronically homeless, because it's not one-time assistance and it's not full wraparound services, right? But for the most part, if you're able to increase your income, you're going through a housing crisis, that's considered a health need, right? You're going, it puts your family into an unstable situation. So to us, that's why I say specifically say housing crisis or something like that. So they categorize it in that manner. They definitely want to make sure that they're serving the most, right? And families with children is something we focus on. So we always ask for family with children through our programs. Again, a couple of videos. But that is our community supports program. Again, that's for everyone, any household composition, single, adult, family. It doesn't matter. We don't question anything either. Even if there's your boyfriend, your girlfriend that's living with you, it doesn't matter if they're part or there's a familial tie with the household. Whoever you say is your household, right? Our next program, this is our newest program. We're still in the baby stages with this one. This is enhanced care management, very similar to inroads, but it doesn't have the outreach part in that aspect. So we have been able to expand. This is for someone, and this can go, you can get community supports with us, and then we can also serve you as an ECM, which is more of an ongoing basis. It's a more hands-on case management, you could say. Our focus has been, every ECM program has a specific focus. Ours has been adults, children, and youth who are experiencing homelessness or housing instability, but they do have to have some kind of complex needs. And the reason for that, I'll go why as well too. Part of what we provide is healthcare services, right? Another person that would qualify would be, if you don't have complex, is a high utilizer, a lot of hospitalizations as well. Sometimes you can't justify that you have a complex need because there's no diagnosis, right? You know, that process you have to go to, get to your PCP, it's very long. But if they're seeing that you're going to the hospital a lot, this would be a program you qualify for, and people that are exiting nursing facilities as well. So we try to combine both of them. Most likely, if you're currently receiving community supports, you may qualify for ECM. If you are ECM client, and we take a little longer to get you to community supports, but we have been able to kind of give people from one program to another and maintain them. What this program provides, we do have a nurse, RN in our teams. We have team of 4 right now, which is a nurse, a behavioral health therapist, a community health worker, and a care coordinator. So this team of 4 gets assigned to the individual that's eligible, and they get connected in the community, right? Connected to their PCP, getting them their medication, coordinating services, getting them transportation. So this gives us that kind of the wraparound arm that we didn't have in the past. Right now we have 2 teams, and we're about to start hiring our 3rd team. There is a quota per team. We have to have at least 300 members enrolled per team to be eligible to open another team up. I will say we've been very successful in the last 6 months. We have over 500 enrollments of members, so that it's completing our 2nd team, which is going to push us to our 3rd team already, and that's why we've been expanding. But again, this helps them not only find doctors, schedule appointments, manage anything transportation, get follow-up care. The community health worker will meet with them on a weekly, daily basis. They go to the member. So although we're stationed in San Bernardino now with our new facility in Loma Linda, we go to the member, as soon as they're assigned, wherever they're located, we start looking for resources locally and connecting them to anything that's available while we're getting them to our community support to try to rapidly rehouse them. Again, this is a new team, everything that we provide is wherever the member is located. We don't require them to come to us in any way, because we know transportation is our biggest issue here in the community, but we go to them. And it is our newest team for that. Here is how we can inquire if you guys have members. We have ECM email. We do have an 800 number as well too for individuals. We can actually do a closed loop referral, so if they come to us directly, we can see if they're eligible and we do a quick 5-minute intake to find out. And then if they are, then we try to, it takes about 30 days with IHP for them to approve for us to be assigned to them as a member. And here's our RN and our ECM program manager information. So for that one, it's directly. And here's some East Valley numbers. In 2024, we housed 13 households. First, second, and third quarter. To break that down a little bit more, in this area, and this is through rapid rehousing through community supports, right? We didn't have any families referred from this side through our continuum of care program, which is that first one I talked about that goes through point of entry. But through community supports, with the amount of referrals we received, we got about 13 that were housed in 2024. So January to May, we had 5 households, 4 from Yucca Valley, 1 from Morongo Basin. And a breakdown for all of them, most of our referrals, if you see down here, we have from both last year and this year, for a year and a half, we had 10 in total from Yucca Valley and 29 Palms. 7 has been our biggest number. These are the 2 areas that have been our biggest numbers. We had 1 from Landers, from Joshua Tree 1, and Jason Valley 1, and Morongo Valley 2. So this has been the last kind of year and a half of referrals just in this area. That we've been able to successfully enroll into services and get them housed in the community. This last 5 months have been 5 households. So we do have a slow traction, but again, we're not the only community supports provider. There's Operation Grace, there's Lighthouse Social Services. This is just based on people that we're getting referred, so it can mean that there's a lot more members being served with other providers, because all the providers serve all San Bernardino County.
Can we refer people to you, or do they have to do it through the CDS?
For community supports, they have to go through IHP. For COC, they do have to go through the CES. But as I mentioned, if they're being engaged and they're in outreach and they're a family that is kind of like, hey, they're in the CES, they're in the housing queue, send me their HMIS number. They have to be an HMIS. I want to emphasize that. They have to be an HMIS. And then I can send it to my program manager to see if we can pull that referral. Because if they'll check that they're ready, we can request that referral if we have funding available.
Because I think we have somebody up here that does the IHP, but they don't have funding for rapid rehab.
Morongo Basin ours is an IHP community supports provider, but the problem is having the money
Because
ahead of time.
you have to pay it and then you get reimbursed, correct?
Correct. They're pretty good. If you have your paperwork, I will say IHP is a lot better than the county when it comes to funding us back. That they've been a lot better. We luckily have been able to, based on our programs and our revenues, we're housing without stopping. We're averaging about 20 households a month between Riverside and San Bernardino County. So we're housing a lot. Our lowest month was 7 households in 1 month this year so far. But we emphasize on housing. We're really busy. We went from having a team of 14 when I started there to 30, and now we're at 52 employees, and we're across both counties, right? And half of our staff is remote, so it's pretty much from their home they can go and service anywhere in the area.
So how many did you say you were housing? I missed that number.
An average of 20 a month,
Wow,
both
okay.
counties, so we're pretty busy.
Yeah.
The biggest impediment, we'll say, is the cost of housing. So we identify over 100 units a month sometimes of availability, but a lot of our households cannot afford them, or it's not attainable. That they've had an income that can afford them, even if we help them. that's been our biggest barrier.
I've been to meetings before where IHP presented, and they said that they do, eviction prevention.
That's part of the housing crisis. So part of community supports, the deposits could go to arrears. So it's still that 5,000 limit. It falls into the same category.
But they can do it.
As long as we have a referral from them, regardless if they're homeless or at risk, it's based on their situation, we have up to 5,000 to assist in their situation, yeah. The goal is a housing crisis. We try to maintain where they stay because once they have an eviction or it's harder to rehouse them, our goal is if we can work with the landlord and they can catch up, then we wanna keep them there. But the issue sometimes become when we go inspect the unit and it's not in livable conditions, it's pretty difficult for us to maintain them in a place that's not livable, right? Sometimes we have to keep them there because that's everything there is. As long as it doesn't trigger an inspection from IHP, they will maintain them there, but for the most part, we wanna put them in a place that that's habitable for them.
It's probably a case by case, but if you find that it's unlivable, what do you do with them?
We work through with them to see what we can find. We continue to work. So that's where it goes. Most likely they're enrolled also to our ECM. That's where we're seeing a lot of the individuals that are not places that are livable, or they have a place and they don't have a refrigerator, they don't have a stove. They're very limited. We're looking for resources, we're connecting it. And I will say, our CEO, like this year, we've found a need, and I'm trying to get us to approve a flexible spending just for our program, right? So if they need that refrigerator, or our CEO will say like, hey, this family needs a cooler or something small, and he'll approve it. He'll be like, okay, send it to me, the situation, and we'll try to, as little as it is, to approve it, because there's no flexible spending for the county, period. But we'll try to look around the community for resources to get them those individuals. I'm asking pastors from all over the place. We're asking everyone and anyone that has those type of resources to help stabilize their situation or help them look at a slower pace to see if there's something that we can find for them. And then connect them to community support so they can get that deposit assistance. But sometimes because they're on fixed income with our seniors, that's where we're helping them enroll to housing authority units or affordable housing units and things like that as well, thinking outside the box to get them on a waiting list somewhere to a place that's more livable for them. So we'll help, because they're assigned through ECM, through community health worker, which is a great resource. They're pretty much assigned to them for any resource connection alongside with the other 3 members.
I have a question. Janet, what's the name of that county-wide system that you guys are supposed to put contact with?
HMIS.
You are integrated with that?
Well, that's why I didn't want to interrupt, because we have to get to half 4, but the this is what I've been saying is how crucial it is that we do the HMIS so we can participate in the COC and the continuum, CES system.
HMIS.
Yeah, so we're missing out on that completely from up here, so that's something I've been trying to tell you guys about.
Yes.
I have a question on you're gonna talk about HAP 4 now?
Yeah.
Okay, so basically the question was, you went through your program, so I'm curious to know, how does the HAP 4 funding application either align or supplement your existing programs?
So when we apply for the HAP 4 is rapid rehousing, to get them rapidly rehoused with low subsidies in their community, right? So the goal aligns perfectly. It's the same thing that we've been doing for about since 2013. The goal was to expand it to get referrals directly from your community, right? It does have to go through coordinated entry once we have it, which is very important that people are going through the outreach and getting them in the housing queue. But it would limit us just to serving and doing the housing search and stabilizing here.
And that's separate and not part of any of the other programs that
We would leverage anything. We would leverage IHP. If they're an IHP member, we want to leverage everything, right? Because then it helps and expands the longer length of services we can do. So it could be that we try to get the deposit and stuff to be able to provide them more rental assistance, low subsidies for a longer time while we're stabilizing them. So the goal was to leverage, and then say they have serious health needs as well, connect them to our ECM team to make sure that their health needs are also being addressed. The only thing that's happened, with negotiation with the county is they said this was gonna be a flexible funding. We were gonna be able to, based on outcomes, and they're coming back with a lot of restrictions. And we are in conversations about that because they're making it so administrative heavy that it doesn't even make sense for us to function. It costs me more to administrate than what the housing services we're putting out, and the goal was to house people and providing it to people, right? To be able to provide that financial and low subsidy, so.
And just out of curiosity, were those restrictions articulated in the,
RFP? No. That's why we're pushing back, cause it wasn't on the RFP.
But the RFP is pretty heavy on like, you have to follow this requirement, this.
Which we are.
And I'm just saying that because I used to work for the US Department of Health and Human Services. So sometimes when the county is pushing back more on you, it's not so much the county staff itself, it's usually coming from higher above, whether it's the state or federal.
It's a
just
trickle down.
So I work
Yeah.
for the county, so I specifically understand, and it's a county, not a funding, cause we talked to the state said it's the flexibility of the county, and they have some flexibility, right? So sometimes it's more of the details of the county, which we fully understand, we've been in conversation and working with them. Everything, our counting systems, our financial can track everything, as well, but it has no admin fund, right? You guys know, in which we're okay with that. We were gonna eat all that cost because our goal was to leverage and provide the services out there. But then they added a lot more paperwork, which we collect a lot of the paperwork, but it's just the amount of work of taking it to put these mini audit for submittal, it's very heavy administrative, right? And again, we track for state and federal funding. We've had city, state, and flexible funding for over 30 years. So we get our own single audits and we pass them flying colors. I think the county audited us every year for ESG. Never any findings, never any concerns. Our systems are in place to track it. It's just they want us to go, back to a lot of this documentation outside of that. That's not required through the funding, which we're very well versed. And again, we'll provide lease agreements, we do inspections, we provide them everything, copy of everything that we do. It's just on the admin side that the way that they want it is a little bit more heavy intensive. And again, we're still in conversation. We're hoping that, we leverage with them as well. We're being flexible and we're giving them options to work with us so we can provide the services. But again, it was something news to us too when they tell us it was flexible funding. And then they're trying to, making sure that it fits 10 different boxes when the funding is not requiring that. And even going through HCD, which is the housing department with the state of California, because those are state dollars, right? So when we ask for feedback, they're like, well, it depends. There's specific things that if we work with them and we can provide them, and we told them we can provide reports, we can provide this, and copies of everything you guys want, but just give us a bigger time frame than on a monthly basis, right? And then our goal is doing fee for service to keep the case management and housing navigation costs down for this contract, because we want most of the money to go to low rental subsidies. Yes. And we gave them a really good deal on that type of, the amount that we were charging just for that was very low compared to what the actual cost was. And that's where we're kind of going back and forth. And that's, again, between us, they've been working with us and they've tried, and we're working with them too to see what we can get out of it. If we can get this through with the county, this won't only help us as a provider, this will help all the other service providers that are getting funding, because it's also an impediment for many of the smaller service providers, right? The amount of administrative heavy that they're making it, that it's not a requirement as long as you're tracking things and you're getting your single audits done, right? So that has been the conversation. We were recently told that, we were the contingency plan for the county here, which some of the money was given back. And we went from $95,000 that we were gonna do for rapid rehousing to $193,524. We were just informed, I wanna say 3 weeks ago, in our meeting. And this is where I know my CEO says, like, we didn't think we were gonna get all the funding, which takes away from the other things that were funded. So if you guys were funding like emergency shelter and stuff, we didn't apply for that. And from what we asked, we can't change outside of what we applied for. So we can't say, okay, we wanna use $100,000 to bridge the individuals that we're serving through this funding. We can't change the scope of work that we already applied for it. which means that all your eggs in is one basket, which doesn't benefit you guys and it doesn't benefit us, because then we have no shelter to send them to, with this funding. And we don't have any flexibility on that aspect unless it comes back to this board. So again, my question is, what are your needs? What is your goal? And what are you guys doing as well, or wanting to do? Because we wanna make sure we're working with you guys on that aspect. I know this is not something any of us saw was going to happen. I know I'm a board member of the Central Valley Region Center, Regional Committee, and one thing we didn't wanna do is put everything in one category, right? So we spread it across the board, and we know how this impacts your area, specifically because there are no shelters out here.
If I can ask a question of the chair,
Yes, sir.
or co-chairs. But I think before we talk about the increase in funding, the information in the agenda packet from Annette Flores from OHS regarding HAP4 funding, did they provide any additional information or guidance on that? Because what they're indicating in the letter seems to be a little bit different than what's being presented by IHS in terms of the residual funding. So I'm not necessarily asking you to be experts on the topic, I just didn't know if they provided you any context with what they provided in the agenda packet.
Are you talking about the talking points that came in last month, is that what you're referring to?
No, the letter called status
Well,
for
according-
HAP4 funding.
This is what he's,
I think
Is
it's
that
the
in the
first
front
one.
well,
Status. Oh, okay, yeah, sorry.
Oh,
Give us
That's all that they provided to us. I mean, unless you guys want an email,
I
that's
got-
all that was provided to me for the minutes.
So I can read this for the benefit of the group, if they would appreciate that. So specifically, Curtis, the contingency plan for the East Valley evaluators for the HAP4 was to distribute funding equally among the remaining recommended agencies. The IHS HAP4 funding remains under negotiation, and Office of Homeless Services is meeting with IHS on May 19th to further discuss IHP4 contract. The COC board will make the final decision in terms of whether it all goes to this organization, or if we have the ability to allocate, to vote to reallocate what MUSD had surrendered. The East Valley Regional Steering Committee will need to make a recommendation to the COC board. This recommendation can include a request for the RFA to be opened for the region. The East Valley does not have the authority to open the RFA.
And what I was referring to specifically, Stone, was the second sentence in the first paragraph where it says not to exceed the agency's requested budget. So if you're indicating here that your original request was for $95,000 was the total amount of your original request,
correct.
then what they provided to you, saying that the additional may go to you, is not what's reflected in this comment. So I don't know.
Well, they provided us a draft contract on May 19th, I believe,
For the
and
full
it
amount.
included the full amount, and they also increased the people that we were serving from 8 to double to 16.
So
When was
they
that,
increased your
when was
scope
that
of
letter sent?
Yeah,
I mean, according,
But-
May 30th.
May 30th, so there may have been a change. I guess what we would
Well,
want to
my-
know is from OHS what the status of this is, and since they're not here, to provide definitive
Yeah.
guidance on how they're handling that, we should probably just continue in terms of,
yeah.
you can still have your questions here, but in terms of what's happening with HAP4, I think it would be appropriate for OHS to provide that guidance to us.
And my understanding from Claudia was that they were waiting on, because we had recommended at one point to open the RFA again, instead of putting all of our eggs in one basket, as you so eloquently put. But I think Claudia said that they could not do anything or move forward until they had finished negotiations with IHS. And since you're still in negotiation, we're kind of in that holding pattern at this point.
so my goal and our CEO's goal is we wanted to hear from you guys so we can also provide the same feedback and be in the same page with them, that we are okay with the 95, we weren't needing, they really didn't give us a conversation that we needed more, right? It was just added to our contract, informed to us, in negotiations, and I've talked to Claudia and Annette, I'm waiting, we provided everything they requested, so we are waiting on them, that's why I don't have updates which way it's gonna go. But the biggest thing for us at this point is to also know what you guys are wanting to do, in that aspect, because I think, being part of the COC board, this needs to be brought to the COC board so it's open immediately if it's going back to RFP, right?
Wait a second, you're part of the COC board as well?
Yes.
Isn't that a conflict of interest?
Well, I wouldn't be sitting
So you're gonna recuse yourself?
of course, because
Okay.
we're the applicant.
I was like, wait a second here.
We're the applicant, so
Okay.
we have to recuse ourselves, but being part of the board as well, this is something, of course, anything that comes up and you guys recommend, of course, I will have to recuse, our organization will recuse themselves because we're the affected agency. We just wanna make sure, we're not going over what the community wants, right, and what their needs are. We haven't had a chance to have a conversation with them again, we're waiting for that as well, but we just wanna make sure, we're not doing something that the community doesn't want, because the regional is who approved us, but for the RFA to open, they are right, it has to go to the COC board. We're in dark in July. I just got an email that our special meeting, that our COC board this Wednesday got canceled, FYI public, and that they're gonna do a special meeting, and we don't have information on that either, so I just got that email right now. I think we were asking about that COC board and what was going, because the agenda wasn't put out, so that was canceled.
Could that work in our favor to get it on this current agenda versus waiting 2 more months for the COC board? Is that possible? Depending
For
what, you know what I'm saying, like.
You guys would have to send it, what your guys' recommendation is, yeah. And I would recuse
So
myself from
just
the room as
understand,
well.
like, the COC board's
But-
only meeting every 2 months now, and it was supposed to be Wednesday, they just canceled it, there was no agenda. So the question is, can we make this decision, get it to them in time to
I
get
don't
the
think
agenda?
that, even if you don't take the money, I'm not sure that it will be earmarked for backup here. So that has to go to the COC board.
I believe it's a requirement of the way this RFA was written up originally with the state, that it has to
Specific
stay
Yeah,
at
it
this
stays
ballot.
regional, it's a state
Because everything
regional.
was divided based on here, it doesn't expire till 2027. It does put any
2 years, yeah.
agency and a little bit of a time constraint, but I still think it's a lot better than most of the funds that they send out in 6 months or 9 months spending.
Yeah.
I pushed them to make a decision. We have been like, hey, make a decision, so we either put it back because it's time that we're eating up, right? This is all time that we're eating up. We wanna make sure that we are collaborating locally, and making sure that everything is being done in the manner that, you know, you guys are the ones that recommended, we applied, we're still willing to do everything we need to, and we are complying with, the county on everything that they're requesting to move forward with this. But again, I know as an observation, as I mentioned, that, you know, putting everything in one activity constrains the community.
And what you're saying is it's actually difficult to spend that much money. It sounds like, oh, we have all this money to spend, but you have to have people that qualify, they have to meet the criteria. So 2 years for $193,000, it may not get spent. Is that correct? Is that
Well,
realistic to say that?
we've spent it. I don't think the spending thing, but I want, being realistic on the households we serve, it's hard to serve them, especially out here if there's no motel or some type of
Yeah.
bridge for them,
Yeah.
right? While we're helping them.
Gotcha.
And originally when we all applied for it, everybody was different categories. We were rapid rehousing, you guys were doing some motel vouchers and specifically like that. So there's no other resources out of this funding to support these households.
I mean, as someone that came out of the housing, you know, the short-term rental market and so forth, watching what's happened over the last four years, you know, I know I could put you in touch with dozens of people that would do this in a heartbeat, you know, that have motel properties and so forth. So I think your program is great, and there's a lot of lack of, it's just so I think we're at a lack for time. We're all rushing from thing to thing, trying to talk. You know, if we could just be recording these meetings, which is kind of what I'm doing, this will be on our YouTube channel. This is a public meeting, you know, so, and I think that trying to get people just being aware of what's out there to talk together, and I think we could have more people participating to make this housing available, so, thank you for.
If we were to say, okay, hypothetically, right, you get the 193.5, and we were to say one of the things that we need is an outreach program, a street outreach program, is that something that your organization is here to do?
It's not something that is feasible for us to grow with funding that's one-time spending, right? Cause it's not something we're doing already. We've ran bridge and motel and contracts with motel, we're very familiar with that. But street outreach it's not, we would wanna get someone that is local already, cause it would be a learning curve for our team in this area at this point.
Okay, and then the next question is, so what I definitely don't wanna do is to rush the process, right? I understand that we're eating up time, but I don't wanna say yes or no, let's do this without really looking at what are the personalized needs that each community have, because our needs, and I'm just speaking as a representative specifically of 29 Palms. So my 29 Palms needs are probably different than Yucca Valley's needs. And Yucca Valley's needs are probably a little bit different than Joshua Tree. All of us have different needs. So that's what I'm talking about. We have a city council meeting tomorrow. I really would like to invite the public to come and speak in open public and say, like, specifically, what do you need? We're also gonna be discussing, I believe, our homeless and housing committee specific to 29 Palms. So I know that we're meeting today, but if we could, if at least on behalf of 29 Palms, if I could have a little bit of time to see how that discussion is gonna go at our city council meeting tomorrow, so that I can give you more feedback on what we would like to see, what the questions are, what are our needs, because you said that was your original question, is what are our needs, right? So I would like to be able to have that extra day. And then also I was looking at the original RFA, and it does say there, because putting all our eggs in one basket, it does say there that you can use subcontractors. The subcontractors just have to go through the county. So let's just say we had ABC homeless, and I'm gonna ask for clarification on this. Let's say we have ABC homeless services, right? And they do have a street outreach program. Is that something that your organization is open to doing, to saying, hey, this is a long-standing organization that has been in our community for 20, 30 years. They have their own street outreach. Would you be willing to work with them?
I would have to go back and speak to our CEO. We've collaborated and partnered. It means that we would have to pay them directly, and then the
Correct.
county would pay us. As long as they can pass a financial audit that the county would do on them, then most likely we could collaborate and partner with them. Again, our financial team is pretty progressive, so I'm not trying to rush a decision today. It wasn't for a decision, it's just to start the conversation sooner than later for you guys, to make sure anything that you guys have to say is getting back to the county, because that's gonna impact this funding.
Correct.
Right? And because we are meeting every other month, it puts very small windows in between, right? To be able to take this to the COC board where it needs to be approved, at least to open up to an RFA again.
So, Marisela, sorry, but the street outreach isn't one of your categories, so.
It isn't, it would have to go, it has to be approved by Office of Homeless Services if we didn't apply for this funding to be street outreach or like emergency shelter. If it has to open up, again, I believe it's gonna be a
unfortunately,
requirement.
especially because with the county having already approved the budget, once that budget's been approved for these categories, you're not gonna be able to open it up to different scopes of work.
It's the same pot of money though through OHS. So
There wasn't a category, so with HAP funding, it wasn't categorized like ESG. ESG has specific categories and caps. With this one, it was based on the community needs of what you guys decided as a board. You guys did not put it as activities. I think everyone applied for what activity they wanted to get contract for and what service they wanted to provide it. So it would, it would be back to the board on specifying that. And if you guys didn't have anybody that originally applied that would qualify and would pass the financial, for those categories, then it has to open up to new providers, right? But if you guys, I believe, had individuals that applied because it wasn't a public RFA, you guys can select the other providers that had originally applied as well, as long as they pass that financials to the county.
If I can, maybe bring some closure here,
Yeah,
we can need to move on. So, it sounds like a couple things. Number one, Inland Housing Solutions is still negotiating with county OHS whether you're even gonna participate in the HAP 4 cycle.
We're hoping we are, we're
Right.
just, yes.
If you are successful in getting that done, you already will have a recommendation for your first 95,000. So really, the question is regarding the additional 100,000 that's out there.
Right.
Sounds like there's an option that if this recommendation to the COC was to just apply it to IHS, that's an option. We would potentially be able to recommend that COC board open it up again, the RFP. Or thirdly, COC may unilaterally decide to just apply it somewhere else. But I think we need OHS to be able to provide that guidance to us in a setting where we can have this dialogue. So whether it's at our next meeting or another special meeting, that would be my recommendation, to have OHS come in and talk through that. And hopefully by then we would have some clarity on whether IHS is even participating. If they're not participating, then the whole thing comes open up anyways.
So Curtis, just to provide just a little bit more detail, and not to unnecessarily prolong this discussion, although it's an important one. So there have been some requests there have been requests to the county that we want to take what MUSD and reallocate it to other organizations and not have it apply to inland housing. No disrespect to inland
Oh, no,
housing.
we understand.
And so what's been a little curious is that I've not heard back, I don't know that Robin has, from the county saying, okay, hey, this is the process, this is how we're gonna do it.
They, in the letter, basically, they're saying that the COC board, that this committee can make a recommendation to the COC board, but the COC board is the one that's going to have to authorize that
Correct,
process to
correct.
occur.
Yeah.
And we can't make the recommendation until after their negotiation, yeah.
Which is curious
Is that what
that
they
now they've got
stated? Okay.
193,000, because I would have thought that they would not have just lumped that in, given the conversations we've had, but maybe we just need to obviously reach out to her again.
So to circle back onto that, one of the things that we had discussed and first off, let's thank Marisela.
Thank you.
Very,
Yes,
thank you. We appreciate you taking the time to come out here and kind of fill us all in on all of this. I would like to know, if you can you please send us a copy of your PowerPoint presentation so that we can distribute it to all the
I
members
sent it
for
to
everybody?
Wayne, but yeah, I'll send it to, who do I
Send it to Christina, I'll go get you her email address, okay?
Okay.
So one of the things that we were thinking about was, did we want to go dark in July on the meetings, but with this, now this time crunch with doing this contract, I think we should go ahead and have a meeting in July, so we'll go ahead and have a regular Thursday meeting. We will reach out to Claudia and ask her to please make sure that she's in attendance to give us an update on on what's going on with the HAP 4 and the contract negotiations. If we get some more information, Marisela, we may ask you to come back out again, and probably not next month, but maybe the following month or something, and have you come out and give us an update on what's going on with your organization and how we're working it.
And at Bernardino, even if you can't make it, if a representative from your organization could be here at every meeting, that'd be great too.
We want to be here at every meeting, but sometimes, I don't know, they conflict with a lot of county meetings.
I'm gonna make sure this is live streamed and it's a public meeting, so I'm gonna handle that to make sure it's
But
well
we're
recorded.
asking for them to have a
No, for us.
representative.
I get it, but we need to use technology to have Zoom capable, I mean, I'm
Eric,
working
my
on this.
concern is if this
Yeah.
money in this region, if this
I
money,
get
like I
it.
said last
Well,
time, is
once-
going to this, then I want your representation.
Of
Well, that'd be
course, and
good.
that is the goal,
They're
like,
nonprofit.
once we get the funding to have someone here every month, it'll take priority as part of our agreement when we receive the money.
Okay.
Right now with the negotiations, and again, a lot of the times, I don't know what's going on with the county, they're lumping some COC meetings
I was like,
that are
us too.
required as well too, and there's only specific people we can send to these meetings.
I
To
totally
represent
understand.
our organization, right? But we were willing to be here and work, and I know I'll be in communication with Janet and the team for any updates, providing numbers.
Yeah, if you can, if you're sending stuff out, please make sure that they go to Stone, myself, and to Christina too, as the chair.
I'll ask Christina for
Yeah.
the information of whom, and I'll make sure I'll CC everybody that's
Okay.
required.
Okay, everybody, I guess we're gonna say no future agenda items for the moment. Presentation, thank you, everybody. Meeting's adjourned at 11:43, thank you for being patient.
Thank you.